Ellen in the studio. Good morning to you.
Good morning.
Good morning.
Absolutely. Thanks for coming in this morning. Ellen, you are on camera first, so you're going to be on the hot seat, if that's okay.
Yep.
Is that all right this morning?
Yeah.
We are talking about the topic of zero suicide, and it is Suicide Awareness Month, and we want to make sure that we keep this in the forefront because when we talk about this in rural communities or larger cities, suicide is a major part of the conversation because, we went through COVID. We still have some remnants of that. There's spikes that happen. There is the problems of financial problems, the stresses of life in general.
Right.
And suicide. And I probably haven't covered everything. You probably have had those conversations. But when we talk about this topic here in rural Mason County, Oceana, Lake County, Manistee County, is it just like if we were having this same conversation in a big city?
I think that's part of the nice thing about the evidence-based practice of zero suicide is it's applicable anywhere you live, no matter what kind of environment, urban, rural, whatever kind of culture there is. So the principles of it, go across the board.
Okay, and Zero Suicide, Lisa, is an actual program that has been developed to help, as it says, to get to the point of even in those first moments of the conversation or those first red flags that come up, that we're acting and reacting. Is that fair to say?
Yeah, yep, for sure. So zero suicide, we just try to implement across our agency, first point of intake, whether that's, a crisis call we go out on, if it's a screening that we're doing or an assessment with the individual, but we're always assessing for those signs and those risks.
And I think today is going to be important for us to dive deep into some of those signs, some of those things that, because it is truly, it's kind of a threefold area. It's number one, trying to, from the individual standpoint, say, what am I saying? Am I actually going down this road that I shouldn't be going down? So I think there's one prong of that. The second would be from a family and a community standpoint, right? From coworkers to those family members in that home. And then the third side of it from the healthcare worker standpoint of what you're doing. And I would assume that there are some red flags that cross all three spectrums. Is that fair to say?
Mm-hmm. Yep, I would say so.
All right. So let's kind of dive right into that. Ellen, zero suicide. Take us through the foundation of that program. Can you define it for us?
Sure. So zero suicide is foundationally made up of 7 elements, and probably crucial to what you were just talking about with being able to identify those risk factors is the element of identify.
Okay.
So it's about training our community, training our staff. You don't have to be someone with a license or have letters behind your name to help someone who's feeling suicidal. And that's the main point of zero suicide is it is about preventing suicide across the community.
Okay. So let's break it down then. If it is at the community standpoint, what from your agency, from West Michigan CMH, are we encouraging those out there to look for, to understand, to notice in that sense?
Sure, I think, and I also just want to make sure I point out that there's a large kind of assumption that if you talk about suicide with someone, that will make someone think more about suicide. Mm-hmm. If you ask questions, it will prompt them to think more about it, put them at higher risk, and that's not the case. Okay. We want people to understand that the best way to prevent suicide is to have that conversation and to ask those questions. So part of it is, on our staff's behalf, is we have a set of standardized tools, suicide risk assessments that we use. And through Zero Suicide, we'll be using some different tools that they recommend in addition to what we already have, so that at different levels of the organization, whether it's the front desk, whether it's a master's level clinician, we will have the tools to ask the questions, to be able to identify the risk, and then be able to help develop a safety plan for that individual.
All right. And if you're just joining us, we're talking with Ellen Plummer, Chief Healthcare Integration Officer, West Michigan CMH. Lisa Nordman, as well here, Director of Conflict-Free Case Management here. You brought up a very good point. And if you don't mind, I don't know if there's statistics in regards to this or research that has been done, but when you said when we talk about suicide or with that particular individual, it does it bring them back this way truly, or it doesn't kind of push them towards that. Then can you kind of go a little bit more into that if you don't mind?
Sure. So I think again there is the assumption that if you talk about suicide with someone who is or is not suicidal, it will cause them to think about suicide and therefore increase the likelihood they will harm themselves. Part of the issue with suicide is they feel very not heard. They feel invalidated. Okay. And when we actually have that conversation, it allows them to say, someone's hearing me, someone's listening. It can be very isolating to have suicidal thoughts, and also can be very shameful. People don't want to feel suicidal, and it can be very hard to talk about it. So trying to meet that person in a place where they feel heard, listened to, validated, and that they are able to express themselves is really important.
Very important. Lisa, I see you nodding as Ellen is making these comments. And one of the elements that came out from her response is that being heard and understood. Do you think, as a community, that we can get to that point where we can reassure them that we are listening to them, rather than saying something like, "Well, you're just kind of crying wolf," and so on and so forth? Mm-hmm. How do we do that as a community, even as a healthcare system as well?
Right. I think the biggest thing is starting by asking that question, because not everyone is comfortable to ask that question, and sometimes people aren't showing those signs, aren't sharing those signs with others, and just asking that question gets them talking about it and being comfortable with asking it and being comfortable with receiving their response. Because their response could be, yes, I'm feeling suicidal. Yes, I'm having these signs and symptoms. So just getting more comfortable with it and aware of it, and how to work with them when they are feeling that way.
All right. At the top of this topic, I talked about, it's my opinion of, the financial stresses out there, general life stresses, going through maybe health issues and such. But from your standpoint, what are you working with? What is life's moments that you're dealing with that people might feel like they're in a suicide mode at all? What's happening here in our local community?
I think a lot of what you've already mentioned, like housing can be a big concern. Financial stressors can go along with that. If you don't have any finance, then, it's more difficult to find housing. Maybe even the resources out there for housing are limited. And, there's not as many places to find to live. So just working through some of those, the healthcare stuff is a big piece too that we're finding more of, and trying to work with, people come in the front door, we're assessing for their health care too, not just their mental health. And we have health screenings that we offer for people to coordinate with their PCP, or if they don't have a PCP, helping them obtain one and working through those.
Let's talk about, and we'll kind of dovetail off of that, about how people are screened for the Zero Suicide program in particular. What is that process like?
Honestly, it's really throughout their care, starting at the front door. As Ellen mentioned, we have the tools to use to assess. There's a Columbia Suicide Risk Assessment that we go through. We have the PHQ-9, which screens for depression. And just having those conversations. We have a support plan built into all of our documentation that kind of identifies, their warning signs and symptoms, triggers, their coping skills that help them, and then their support people in their life.
And what about if they don't walk through the door? Are you able to still take the elements of this Zero Suicide program and extend that, over the phone or in person in the community? And can you elaborate on that?
Yeah, for sure. So, if they don't walk through the door and they give us a phone call, we can do the screening over the phone as well. If they can't make it in or whatever the case is, we can kind of go through those questions with them too.
All right. Ellen, how important is this program? You've been with West Michigan CMH for how many years now?
15.
Okay, and you've seen the adaptation over the years of trying this and that and so on and so forth with different programs and studies and such. In your opinion, what does zero suicide mean to you and to those that you work with out there?
Sure. I mean, I was introduced to zero suicide a couple years ago as part of our grant with CCBHC, and what's amazing about zero suicide is the multidisciplinary framework of it. It is about every aspect of a person's world and system coming together to help prevent suicide, and it was built out of physical health care and behavioral health care together. Okay. So groups came together to build this model, and I think it just allows, again, it doesn't require someone to have a special degree to be able to help someone who's feeling suicidal.
Mm-hmm. Take us through those red flags. We have that as a topic whenever we talk about suicide awareness and such. But what are those flags that listeners and viewers out there can really say, okay, because somebody's not always going to say, you know what, I'm thinking about killing myself. They're not always going to come out and say that. What are the other flags? What are the other, those comments or even actions that we can see?
I think, it's very hard to say there's like a cookie cutter way a person behaves when they're suicidal, and we can just go, yep, they're suicidal, even without asking the question. But some of the things they talk about are a very distinct change in a person's behavior. Maybe someone who was originally pretty outgoing, pretty social, all of a sudden is withdrawn and isolated. So things like that. Maybe someone talking about ways they might harm themselves or that sort of thing. Again, it's not necessarily, and that's what's the struggle with preventing suicide, is it's not always easy to see.
Mm-hmm. Absolutely. Lisa, anything to add to that in your interactions with others?
I think a lot of what Ellen said, holds true. The behaviors that, and maybe, with asking that question, maybe they aren't comfortable to come out and say, yeah, I've been having these thoughts. So just being aware of like what is normal for them and what behaviors are they displaying now. Maybe they are more withdrawn. Maybe they're saying thoughts, like making comments. They're not directly saying, yes, I'm suicidal, but maybe it would be better if I'm not living anymore, things like that.
One thing that I've been thinking about over the last couple minutes as we talked this morning is, let's say somebody has those stressors they're pushing them that direction. Let's say you mentioned housing. Mm-hmm. Do you believe that the easiest way to bring them back is to solve the housing, or does that the mental side of things kind of resonate still? Is there? Do you see what I'm talking about? Is there still some repairs that need to be done?
I think they can often go hand in hand. I mean, it depends, of course, on the individual. But yeah, I mean, making a plan to work towards that housing is definitely important. But we don't want to dismiss those mental health symptoms that they are experiencing and make sure we're taking care of both of them.
Okay, very important. So that we don't miss this, my next question is, what in particular with West Michigan CMH, and you kind of hit on it a little bit today, but is there anything that we've forgotten to talk about in regards to this process, the zero suicide process, or elements of West Michigan CMH that is available for those individuals that walk through the door or that pick up the phone and call?
Yeah, so we have our crisis services that we offer in our mobile crisis. So that's 24 hours a day, 7 days a week that anyone can call and request, if they're struggling and want to be seen or talked to, we can go out to them or meet them where they're at. I mean, that's the teams can help with handling that. If it's an open consumer, we have our specific crisis team that assists with that as well.
Okay. All right. And Ellen, same question if we've missed anything. And we have shared that phone number on our Facebook page and our YouTube channel. We'll do that on the air, too. It's 800-992-2061, and it's 7 days a week, 365 days, 24 hours a day. That's an important element for people to reach out to if they need help.
Correct, yes. So, yeah, I think, it's just very important that part of of the zero suicide approach is that there's no judgment, there's no blame, and we're trying to really create that culture in our organization. Suicide impacts probably almost every single person that we know, whether we know it or not. So it's just about creating a culture where it is safe to talk about and we can continue to prevent death by suicide.
All right. And for complete clarification, the Zero Suicide Program versus kind of any other suicide programs out there or awareness. What do you think the biggest element of it, or the most important part of it from the healthcare worker standpoint that you draw out of this program?
I think it's truly just how multifaceted it is.
Okay.
It's applicable across so many different systems and so many different environments, and it really has taken the best parts of individual approaches and practices and created the zero suicide approach that is really able to serve many, many people.
Okay. And I think, as you mentioned that, it's important for the viewers and the listeners to know that the Zero Suicide Program is not just one person and one patient or
Right.
one person. How many different people are part of that at one point?
Well, I guess it's everyone.
Yeah,
I mean,
it's a
Okay.
whole
yeah.
organization.
Yeah, so for us as an organization, we're training every single staff person regardless of what their position is in the
Okay.
organization. So again, it's not just clinical staff. It is the front door, it's facilities, it's finance, everyone. And again, that is to try to really embed the concepts and the principles into our organization.
All right, very good information there. Again, the phone number to call if you need to reach out at any time is 800-992-2061, 7 days a week, 24/7. And Lisa, somebody is going to be on the other end of that line that, as Ellen had mentioned, and you as well, that is educated on zero suicide, and be able to talk to that person and try to get them, off that ledge a little
Yes.
bit, right?
Yep, most definitely.
All right. We appreciate you coming in this morning. Thank you, Lisa Nordman, and as well Ellen Plummer from West Michigan Community Mental Health. Continue to do what you're doing,
Thank you.
and it's great to hear that that every staff member is educated on a program like this, and because you can imagine somebody coming through the door at West Michigan CMH or anywhere, that first person is sometimes the most influential in some
Correct,
cases, right? Absolutely. More information, West Michigan Community Mental Health. Check them out on their website as well as social media. But again, that phone number on our Facebook pages as well as our YouTube channel if you have any concerns there. And my last question, Ellen, is it is okay to have that conversation out there from a community standpoint with people that may be struggling, and that sometimes is the first way to interact or react to that, right?
Oh, definitely, yeah. I mean, we have to have the conversation or we're never going to know if there's a problem.
All right, very, very good. It's Suicide Awareness Month, and so let's keep this conversation going. All
Thank
right.
you.
It is now 8:39 here on 102.7 WMOM and Hot Country Hits 99.9. If you missed any part of this segment, you can watch it in its entirety on our Facebook page as well as our YouTube channel. It is 102.7 Mom FM.
Thinking about moving to beautiful Ludington? Well, House of Flavors is looking for an experienced electrician. If you have your journeyman or